Feeding the client who cannot feed themselves. This skill is used for the patient who is unable to feed themselves due to illness or injury. If performed incorrectly, it can lead to malnutrition, weight loss, and aspiration. You have 3.5 minutes to complete this skill. You will need a food tray, wipes, a clothing protector, and napkins.
Hello, Miss Kanisha. I'm Nicole and be a caregiver today. I'm going to have a snack for you. Are you hungry?
Yes.
Okay. So I'm going to go here. We want to put the bed in the lowest position because when you're going to have to sit down when you feed your patient, you always want to be at eye level. You never want to stand. You don't want your patient to feel uncomfortable. The head of the bed needs to go up 75 to 90 degrees so your patient doesn't aspirate. So I'm going to put the head of your bed up 75 to 90 degrees. And again, just like mouth care, it's better to judge the distance when you stand to the side of your patient instead of in the front of your patient. There's no privacy on this skill unless your patient requests it. So I'm going to go ahead and wash my hands and go get your food, and I'll be right back. So I'm washing my hands. Grab your food. Okay, as soon as you come in, before you do anything, before you start to feed your patient, you want to make sure you have the right person. So I'm going to have you to state your name out loud for me, please.
Kanisha.
Okay, so her name also matches the card. Now, if you were actually taking care of a resident or a patient in a facility, you also want to check and make sure that the diet matches the card. Some people have special diets. We have diabetics and pureed and different textures, so you want to make sure that all matches. Okay, so you want to come close. You want to make sure your patient is able to see the food that you're going to serve her. So what we're going to do now is I'm going to ask you if it's okay if I put the clothing protector on you to protect your clothes. Is that okay?
Yeah.
Okay. So I'm going to put them in, lean forward just a little bit. Okay. So you want to take our hand wipes. I'm going to wipe the patient's hands. I'm going to wash each one. Make it a clean section. I'm going to wipe her other hand. This is just in case your patient wants to help feed or eat a roll or something. Okay, so we put that in the trash. And now, Miss Kanisha, we have Jell-O. And we also have fruit. We have mandarin oranges. Which one would you like to try first? And we also have a little apple juice for you. Okay, so we're going to go with food first. We're going to take a few bites and then we get to drink some juice. Which one would you like to try first? Mandarin oranges. Okay. So make sure your patient can see. Those are my favorite fruit. I'm not really a fan of canned fruit, but I love the mandarin oranges. What would you like to try next? Okay, so after every 2 bites, you're going to go ahead and offer your patient something to drink. So would you like to have a drink?
Yes.
Okay. A little bit of juice. Okay, would you like anything else?
I'll try the Jell-O.
This is Jell-O. Would you like anything else?
No, I'm good.
Okay. So you did pretty good there. So what you want to do now, so we washed our hands in the beginning, so now we're going to take a clean napkin and wipe the patient's mouth. And then we're going to go ahead and wipe our hands one more time. How'd you like the meal? Pretty tasty?
It's yummy.
And when I was little, my mom would mix the fruit with the Jell-O. It's pretty good. It kind of brings back memories. Okay, so we're all done. So before we take the tray out, I'm going to go ahead and take the clothing protector off. Lean forward just a little bit, please. And you want to roll everything in just in case there's any food spill. Just roll it into a ball. Get everything encased. And then it goes into the dirty laundry. Okay, I'm going to go ahead and take your tray out and I will be right back. Your hand wipe wipes in the garbage, the tray back. Okay, so I'm gonna wash my hands and come back in and get everything set up. So I'm gonna go ahead and the table back where we got it. You wanna make sure your patient doesn't have anything to fall over. Okay, the bed is already in the lowest position. So just for safety purposes, to make sure your patient doesn't aspirate, you want your patient to sit up for 30 minutes after they eat. So I'm just gonna get you off your tailbone just a little bit. Okay, so I'm gonna leave you sitting up for 30 minutes to make sure you don't aspirate, give your food a chance to digest. Here's your call light just in case you need me before 30 minutes is up. Let me say anything I can do for you before I leave.
No.
Okay, you have a great day. I'm gonna wash my hands, document the meal served, and the skill is complete.